Hello, Vivian.
Hi, Glennis. Can you hear me?
Mm-hmm.
Okay, so we have about 18 people in the waiting room. Just want to see if any of the speakers are there. Not yet. Hi, can't
And
you
the
hear
person
me?
Pick Up Africa. Do we have the person from Speak Up Africa here yet? Hello, Vivian. I cannot hear you.
Not yet.
Okay. So I'm going to introduce them.
Let's wait and see.
Can you hear me?
Yes, I can hear you clearly.
Sorry, I guess I don't know. I think something is wrong with my laptop. Um, so I'm accepting people in now.
Okay.
I'm coming. Hold on, let me see. We have any of the speakers. I can't see any of the speakers on the call.
Let me
I
see.
have one of them on. Um,
What did you say?
I see
Mm.
Snyder is on.
Yeah, I see Snyder as well. Yes,
Yeah.
she's here.
Okay, who else? Who else? Okay, so admitting everybody now. We're live streaming on YouTube at the moment.
Okay, yeah.
The landscape of healthcare is rapidly evolving, and digital innovations are playing a pivotal role in transforming the industry. Across Africa, women are striving to be a part of this transformation, shaping the future of digital health. Join us for an inspiring event that celebrates and elevates the voices of women who are pioneers in the digital health sector. Our upcoming webinar, African Women in Digital Health, is designed to ignite discussions, foster collaborations, and spotlight innovations driven by African women. Mark your calendars for the 26th of April at 4 p.m. West African time. Whether you are a professional in healthcare, a tech enthusiast, or an advocate for women's empowerment, this is a place for you. Featuring keynote speakers from industry experts, interactive panels, and a showcase of cutting-edge digital health technologies. Engage in lively discussions, ask questions, and gain insights that could shape the path of digital health in Africa. Get the chance to discover the top 15 finalists for our African Women in Digital Health International Women's Day Award 2024. Register now for our webinar on African Women in Digital Health and be part of this transformative journey. We look forward to welcoming you to the African Women in Digital Health webinar. The landscape of healthcare is rapidly evolving, and digital innovations are playing a pivotal role in transforming the industry. Across Africa, women are striving to be a part of this transformation, shaping the future of digital health. Join us for an inspiring event that celebrates and elevates the voices of women who are pioneers in the digital health sector. Our upcoming webinar, African Women in Digital Health, is designed to ignite discussions, foster collaborations, and spotlight innovations driven by African women. Mark your calendars for the 26th of April at 4 p.m. West African time. Whether you are a professional in healthcare, a tech enthusiast, or an advocate for women's empowerment, this is a place for you. Featuring keynote speakers from industry experts, interactive panels, and a showcase of cutting-edge digital health technologies. Engage in lively discussions, ask questions, and gain insights that could shape the path of digital health in Africa. Get the chance to discover the top 15 finalists for our African Women in Digital Health International Women's Day Award 2024. Register now for our webinar on African Women in Digital Health and be part of this transformative journey. We look forward to welcoming you to the African Women in Digital Health webinar. The landscape of healthcare is rapidly evolving, and digital
Good day, everyone. Good morning, good afternoon, good evening, wherever you are, and welcome to our webinar on African Women in Digital Health. We are thrilled to have you join us today. We have been planning for this event since forever, and we are very glad and grateful to see you here. We had registrants from over 300 registrants from across the globe, but especially from Africa, which we are really excited about. So we'll just take a while to settle in, and as other guests continue to join in, please take a moment to introduce yourself in the chat and share where you're joining us from. We really want to see who is here today, so please go to the chat and tell us your name and what country you're from. Let's just wait for other guests to join in now. We have an exciting lineup of discussions and presentations planned for today, so get ready to be inspired. Let's just wait a while as others join in. Hi, Antoinette from Ghana. Thank you for joining. Thank you. Hello, Margaret. Hi, Marianne. These are women. This is interesting. I mean, the point was to cut across, right? Both men and women and healthcare professionals and advocacy professionals and technologists and entrepreneurs, but we're happy. We're happy to see the women especially. Marilyn from Kenya, Mariam from Somaliland, Wilfred from Kenya. Oh my God, so it's hard to catch up. Thank you guys so much for joining us. Nura Izzat from Uganda, Marianne from Kenya. Welcome. That's Neem from South Africa. You're welcome. Michelle from Kenya. Nirupa from Seattle. Thank you. Mercy from Kenya. Rahima from Tanzania. Mercy from Kenya. Wilfred from Kenya. Thank you. Okay, it's hard to keep up. Marime from Senegal. Anima from Switzerland. Ariola from Nigeria. Jean d'Arc from Rwanda. Jean from Kenya. Paris from Kenya. Vanessa from Dubai. Dr. Adrienne, oh my God, we have to make a round of applause for you. Adrienne is on our advisory board. Thank you so much for joining. I am a huge enthusiast. I mean, she has a very exhaustive digital health profile, and she has been very supportive of Digital Health Africa as an organization. So thank you very much for joining. Joy from Nigeria, Placid from Rwanda, Mary from Kenya, Rashidat from Nigeria, Sheila from Kenya. We do have to give it up for the Kenyans. Thank you very much. This a high Kenyan representation here. Debbie from Nigeria and Dorel from Marrakesh. Dr. Joanie from Benin. Thank you. Shiro from Kenya, Colombe from Marrakesh, Judy from Nigeria in USA, Shelby from the US, Zainab from Sudan, Opeyemi from Nigeria. Is that our Opeyemi? Olanyika from Nigeria, Esther from Nigeria, Rodney from Uganda. Oh my God. This is getting us excited. I mean, if you know how long we have tried to put this together, especially because we're such a baby organization, and to have you all tuning in and joining us is such a huge show of support for us. That gets us very excited. We hope that you are as exciting as we are, because we have brought together for today a very formidable panel to have these very crucial discussions around women in digital health, as well as the fact that we will be showcasing some women who are doing some incredible work in digital health on the continent. So thank you for riding with us. We would be here for just over an hour, and we hope that you stay with us through then. We hope that this is very inspiring, but also very informative for you. We have done our best to ensure that. So we will just wait 1 more minute for participants, and then we would officially kickstart the webinar. Thank you. There's so many other names joining in from around the world, and we wouldn't be able to go through all of that, but we see you. Thank you so much. Hi again. It is 10 minutes past 4 p.m. here in West Africa. So we will begin while the others catch up with us later. Again, welcome to everyone to the official start of our webinar, African Women in Digital Health. This webinar is hosted by Digital Health Africa in partnership with Speak Up Africa. I'm Glenys from Digital Health Africa, and I will be moderating today's event. I hope you are as expectant as I am about the webinar. Our agenda features two main things, really: a dynamic panel discussion with esteemed women leaders in digital health, and an award spotlight celebrating African women who are doing some incredible work in the field of digital health. I want to say again that we're very grateful to have everybody joining us. We know that time is a valuable resource, so we are honored that you're committing some of your time to be with us for this event. Right before we begin the panel discussion, which I'm trying not to be too excited about because of our panelists and all that I know that they have to share with us today. But just before that, I'll take a moment to share a bit about Digital Health Africa and Speak Up Africa, and just why we're creating this event, and what's the why behind it. So Digital Health Africa is a non-governmental organization founded in 2000. So we're just a year old. Our work centers around the use of media and publication to drive digital health forward, the whole digital health agenda. If you've been following us, you'll see that we have community engagement programs. We are creating networks of students and workforce of digital health professionals. We host a digital health podcast called Digital Health Voices. We carry out landscape research and analysis of the ecosystem in Africa. We write thought-provoking articles, amongst other things, all of which we always share on social media and via our website. We are a youth-led, and I need to say that we are a female-founded organization. That's important to say because we're very proud of our founder. Speak of Africa is an African think tank headquartered in Dakar, Senegal, doing a lot of reputable work on policy and advocacy in Africa, especially around SDGs 1 to 6. They mediate and lead crucial conversations that are transforming African societies, empowering Africans, enhancing African leadership, and basically fostering sustainable development on our beloved continent. So we at Digital Health Africa are obviously elated to be partnering with Speak Up Africa for this event. We see more people joining in. Thank you very much. Please feel free to introduce yourself and where you're joining in from. We may not give you a shout out, but do know that we see you and we're very grateful. So we just introduced Digital Health Africa and Speak Up Africa, the event organizers. And just before we head into the panel discussion, I want to take a moment to share the why of this event. So this is not just another event where we're trying to talk about women in some space. It is true that the outcome is we want to inspire. We want to show that there are women doing incredible work around digital health. We want to create the opportunity for younger women and even younger males to see these women and see the work that they're doing. But we also want to give the opportunity for discussions to be had around what kind of challenges women face in getting into this field, in making a mark, in leading innovation, or just any kind of entrepreneurship around healthcare in Africa. But why do we want to have these conversations? Because digital transformation is here to stay, right? Technology is only going to get more advanced. And this is not one of those transformative points in society where we want women to be left out. And so we want to be part of the group, we want to be part of the voice that is trying to have these crucial conversations to get women included, making their contributions in real time, just so that at the end of the day, we have a digitally transformed healthcare ecosystem in Africa that is very reflective of and inclusive of women's needs. So right ahead, we will go ahead with the panel discussion. Our first speaker, I am very excited, like I said. Our first speaker is Carol Kamasaka from Path Uganda. So Carol I'll just introduce her a bit. I'll introduce each of our panelists a bit just so we get to know them. So this is not trying to hype them. Trust me, this is a summary of who they actually are. So Carol has been in the digital health space for over a decade, implementing digital health interventions across Uganda and several sub-Saharan African countries. She has a huge portfolio of partnership projects, as you can see, with reputable funders like the Global Fund, USAID, Rockefeller Foundation, WHO, UNICEF, CDC, Gates Foundation, and trust me, this is not all that she is. So she's currently the Senior Program Officer for Digital Health at Path Uganda, and of course, we are very thrilled to have her here. So Carol, if you can just say hi to the mic so that our guests can hear your voice.
Hey everyone, I'm really happy to be here. Thank you so much for the introduction, and I'm really looking forward to the panel discussions. Happy to have everyone here. I see that many other people joining in. I'm sorry, I'm trying to save on bandwidth. I cannot show you my video right now, but yeah, that's exactly how I look like, and this is exactly how I sound. I'm really excited about this webinar, and thanks to Speak Up Africa and Africa Digital Health for the work you are doing. I'm always happy to speak to our people, to speak to the women in digital health, specifically African women in digital health. Thank you.
Thank you, Carol. Thank you. So we'll introduce our next speaker.
All right, I think Glennis is having internet connection.
Oh,
Hello, everyone.
yes. Sorry. I was
Yeah,
speaking on.
back.
Sorry.
All right.
Yeah, I was enthusiastically introducing Stephanie, so I'll just take that again. So, Dr. Stephanie Watson Grant, and I did make a point to say she's a professor actually at North Carolina University. So Stephanie is currently the Deputy Project Director for Country Health Information Systems and Data Use at John Snow Inc. And she has been in the digital health space for over 20 years. She has really been in digital health project implementation, and she has more of a global scope of things and as well as the academic side of things. So she has been into foresight and she has been into implementation in real time. And so it's one of those ways that she is crucial to be part of our conversations, because she can tell us, from her perspective of where we are and what we can do to go where we're going. So thank you very much for joining us, Stephanie. And if you give us the privilege to hear your voice now, just before the panel discussions, to say hi to everyone. So Stephanie will be joining us in a while, but we will just go ahead to introduce Snyder, who is our last guest on the panel. Slides, please. Thank you. So Snyder is currently incubation. As you can see, Snyder is the youngest on the panel, and this was very intentional from our end because we wanted to show that women are making a mark in digital health, women of all ages. So Snyder is currently incubation and finance lead at Vigor Africa. That is a big name when it comes to venture and capitalists investing in digital health in Africa. And that's where Snyder is. So she's involved in compliance and regulatory requirements and implementation of budgets, management of awards there at Snyder. She is highly certified, as you can see. I cannot go through all of her certifications, but we are trying to show you that she is well equipped to give us her opinion or her thoughts on where entrepreneurship is when it comes to digital health and how women are contributing to that space. Snyder is multilingual. So again, if you want to ask a question in French or in Swahili or in any other countries or in any other languages, please go right ahead. Thank you very much for joining us here, Snyder. Thank you very much for representing the younger women. And if you could just say hi so that our audience could hear your voice.
Hello, thank you for that wonderful introduction. I hope you can hear me. I think my internet is a bit shaky, so I'm going to turn off my video. But yeah, my name is Naida Mugese. I'm excited to be part of this webinar and looking forward to the discussions and the questions and our.
Thank you very much, Snyder. And yes, we can hear you loud and clear. So we will go straight into the first part of this webinar, which is the panel discussion. So for this panel discussion, we would ask questions to every member of the panel, to which they'll share their thoughts. But if you have questions along the way, please drop them in the chat. But there will be a portion at the end of the panel discussion for you to ask questions via the mic or via the chats. So please just tag along and keep your questions. I'm sure the panel will be very happy to respond. So on to our members of the panel. So this is a general question that we would have every one of them respond to. And this question is, could you share what your thoughts are on the current status quo of digital health in Africa, particularly with regards to female participation and women-led initiatives in this space? So I guess we'll just start with Snyder. Just tell us your thoughts on what the current landscape is.
Yeah, thank you for that question. And actually, I know that women are really showing up in the. Recently, we had a call that launched and closed out about 3 weeks ago. And just because we had to do things differently, we had women from about 20 countries applying, and 70% of them had digital health. And just to speak to that is, on the other side, there's a lot of initiatives that are coming up to support these women entrepreneurs. And just to speak about, female specific funds like Afrishella, incubators like Vilgro Africa, and Women in Tech by Stanchart. And also we see players like Mawazo Institute, which is trying to help women to translate their research into viable business ideas. And to our perspective as an entrepreneur support organization, pharmaceutical players like Johnson & Johnson, who are coming up and saying that we see women are doing a lot of work and we need to come up with initiatives that really specifically support them. So I see a lot of dynamics where there's players that are coming up to support women that are innovating in the space, and women are actually meeting them in the middle. That being said, it's not with its challenges. We still see statistics like only 2% of funding that is coming to the continent goes to women-founded startups. And so I think it's a work in progress at this point. But I'll hand it over to you. Thank you.
Great, thank you, Snyder. So in summary, there are ecosystem actors who are willing to support women in digital health, and there are women showing progress. So if there's anybody in our audience who is thinking about this, like Snyder said, just know that there are people there in the ecosystem who are more than willing to welcome and support you. So maybe we hear Carol's thoughts about this, about the current status quo of digital health in Africa with regards to female participation. Carol, please.
Thank you so much. And adding on to what Snyder has said, it's very exciting to see that now women are no longer scared of stepping into this space, which was initially very male dominated. And also to note that the gender agenda is really being driven. And it's also exciting to know that right now donors and funders are looking at women startups, women technology startups, women owned startups, and women owned initiatives. It's very, very exciting to see that now women have also embraced technology and they really want to adopt it and push the agenda forward, especially for digital health. I must say that way back about 10 years ago, there were very few women in digital health. There are very few women in technology. You'd even go to conferences, to these technology conferences, the health tech conferences, and you'd see the same women. And Stephanie, I don't know if she has joined us already. Stefan can attest to this. It was always the same faces, us, the few of us who have been in this space for more than 10 years. But right now we are seeing different faces. We are seeing these new and young, energetic ladies that have embraced and joined this tech space. And I do encourage really them not to give up, not to look at this like a discouragement, the little funding that is coming through. It's always good that we are starting from somewhere. It's good to know that the women are being noticed, their work is being noticed, the little startups are being noticed and not going unseen and unfunded. So it's really a good start and we will get there. Thank you. Over to you, our moderator. I don't know if you're able to hear me.
Right. Yes. Thank you, Carol. So thank you very much for emphasizing the fact that we do have actors who are willing to push the women agenda forward, and it is a good time to be a woman in digital health in Africa. So Stephanie hasn't joined us just yet. So we will move on to the next question, and I will just continue with you, Carol. It looks like it's a good time to be a woman in digital health in Africa. So well, I would ask you to kindly share some insights into your journey as a digital health specialist, particularly focusing on your experiences in designing and implementing interventions, but also in how did you overcome these barriers at a time when there were not that many women in the space and it was not so common and maybe the ecosystem was not so favorable. What has your journey been like to be where you are today, especially because we want other women to follow footsteps?
Thanks so much. It's been a journey of more than 10 years. I did start in this journey in 2013. And specifically for Uganda, that's around the same time digital health was being introduced. It was new. And at that point, working in public service where most of the public servants and civil servants do not quickly adopt and embrace technology, it was both exciting and scary, but it was an opportunity, one, for me to jump on it, having had a background in information technology. The unveiling, I had an opportunity to design most of the workflows that are now being used in the health facilities. I had an opportunity to design workflows that informed design of the community health information system that is now being used at the community level, because I had had experience working with the paper-based tools, and I also had an opportunity to see the pain that our health workers go through in, especially the community health workers, in ensuring that these paper-based tools are kept very well. It doesn't rain on them, they're not dusty, and the records are kept intact. So it was an opportunity for me to also work with the health workers to design user-centered applications for them that were largely mirroring their primary digital tools. I must say, being a male-dominated field, our voices as women usually go unheard. You'll probably sit in meetings and your ideas are not really given that so much attention like the ideas of men are given the attention. But every challenge that presented itself, I used it as an opportunity to better myself, to speak louder, to be heard, to be noticed. And also the biggest challenge is that most of the health workers at the grassroots are women, and these are women who are nurses, didn't really go further. As women, me being a woman introducing these digital tools to women, I to help them easily adopt these tools. So it's really a good time to be in digital health. It is aspiring to come up and not leave them behind, because but I also want to
Hello, Carol.
there have been men who I made my allies within this, because you always need a hand holding, and the men were there before us. Most men were there before us. The women have been really few. So I used this. Yes, can you hear me?
Yes, I can hear you. You broke out for a bit, but we can hear you now.
Hello, can you hear me?
Yes, Carol. Yes, we can hear you.
And hear me? Oh wow. But I'm saying who are in this field who was there before us, it is, and they are really, really willing to support. I've seen men who have supported. Yeah. Okay. I don't know if I'm still breaking.
No, we can hear you, Carol. Your conversation about how you collaborated with men who have been interested in supporting women in the field.
Can you hear me?
Yes, Carol, we can. Yes, we can hear you now.
Okay. Yeah. I was saying that men who have been in the field and are able to support us, the women. But I also want to say that once you're a woman and you're up there in this field, kindly hold this field. It's an exciting field. It's an open new field and a growing field.
Hi, Carol. Can you hear us? It seems like you broke off again. But Carol had made some PowerPoint right before she broke off. And notably is the fact that even though there were challenges in the space as a woman in a male-dominated space, she did see every challenge as an opportunity to grow and as an opportunity to make her voice heard. Another point that she raised, which I found interesting, is the fact that she used the existence of community workers being female to her advantage. So in a sense, in a way of it, there's women's healthcare that women can relate to. And those are spaces where women can explore as a digital health entrepreneur, for example, because those are spaces where we relate to the most. So thank you for bringing that up, Carol. Yes, and she just said she's back. Thank you very much. But we did get your PowerPoints. So to switch it over to the other side of it, especially because Carol is speaking from a public a public side of it, as in she was maybe working with the government in that sense of it. Now let us go to Snyder, because Snyder is more in the private sector space, in the entrepreneurship space. And Snyder, we just want you to tell us how, in your experience, you have seen women-led startups reshaping the digital health space. Have there been women-led digital health solutions? What are they doing? You know, are they making a difference? What has been your experience there?
Thank you. Thank you for that question. So, and I'll refer this to a call that we did recently. Initially, when we started out as Vilgro Africa, really like maybe say 5 years ago, not started out, like when we started out really looking at our portfolio and noticing that in as much as we are doing a lot of good work in supporting entrepreneurs in healthcare, there were so very few that were really supported by that were founded by women, say women-led companies. And so since then, which is like about 5 years ago, we started by first doing thematic calls. Initially, we would just put out a call. It's general. We are reaching out to everyone in a specific thematic area, say digital health. And then we noticed that that wasn't really working, especially if we wanted to get a lot of women-led companies. So we then moved into doing thematic calls, and we did that 2 years in a row. So putting out specific calls for women-led innovations in healthcare. And yeah, we did get some strong applications. But then we also noticed that when we did it the second year, we essentially just got the same women, the same innovations. And so we felt like we weren't getting the impact that we really wanted to. So what we've done differently for this call that I was mentioning earlier was we actually sat down and decided that we are going to do it in a very different way. We are going to first speak to women and see what they're working on, how they're doing it, and what are the challenges that they are facing in terms of just them being able to show up and apply for such support initiatives. And so the result of that was we actually were able to suffice some very strong, a very strong pipeline of applications, and most of them were around maternal health, sexual health, and reproduction. And the reason why I'm picking out these three areas is because it goes to show how the role that these women are playing in when it comes to innovating around gender-related health issues, right? And so you find that these solutions are very unique. Like, for example, I'd give you a company that I came across very recently that is a therapeutics platform for families with neurodivergent children, such as those with autism. That's something that only a woman who knows where the pain pinches would come up with. Another good example is an innovator who is not only trying to make sure that women are exclusively breastfeeding their children by supplying the breast pumps, but also creating communities and a platform where they can interact and have ambassadors that are actually advocating for this. And so you see that such innovations not only end with the entrepreneur and the employees that are employed, but it cascades to the community and the health of the children. And so I've seen women-led digital health solutions that are actually touching lives in communities and creating a lot of impact. And most of them are really, really unique solutions that just go beyond the usual, telemedicine platforms, but also thinking through how do we reduce the burden of unpaid work for women? How do we free up some of their time, like for instance, with this online therapeutics platform, so that they can be able to work and be able to enjoy their time, right? And not only just focusing on raising their families and the traditional roles that have been given to them. So very, very interesting, unique solutions that we've been able to suffice and support over the years. Thank you.
That is so inspiring, Snyder. That speaks a lot, in fact, to the point that Carol was trying to make, because it is an opportunity to do something that in many ways only a woman can do. Because as a mother, when you create a solution from a lived experience, then it becomes a very relatable solution. In many ways, even it may be a more usable solution because you are speaking to the user, experiencing something that you yourselves have gone through. So that's a very key role that women who are leading digital health solutions, especially those specific to gender health issues or women health issues, are making that mark in. So again, that's a space that upcoming digital entrepreneurs can explore, because like Snyder said, there are a lot of openings to encourage them. But I'll just follow up with you, Snyder, because we do see that gender specific barriers in this space have existed for long. But I want you to tell us now from two angles. First of all, from an entrepreneur's angle, how can women overcome these gender-specific barriers in accessing funding and resources for their ventures? But also from the other end, how can industry leaders like Velcro or policymakers foster a more inclusive space that can encourage women in digital health entrepreneurship? So how can barriers from the entrepreneur side and policymakers from the industry side, how can both stakeholders go about bridging these gender-specific barriers for women in digital health?
Thank you for that question. I'll start with what the entrepreneurs can do, women in digital health can do to break those barriers, and indeed they do exist, and we cannot deny that. We can only move forward and see what we can do in our capacity to change the status quo, or rather to just make sure that we are breaking those barriers and we are showing that we are capable of that. And one thing I like to say is that, there's this narrative that women, and I've had this before, where, women are not bold and they're not confident, and so they don't apply for opportunities. I don't think it's about boldness and confidence. I think women are very, very bold. And that to me is my observation from the work that I have done and the women that I have supported over the years. Some of them are really doing incredible things. Like like one is a really good friend of mine who's providing home-based care, and that's just one example. There's there's a lot of women doing a lot of good things, and so that shows that it's not a matter of confidence, rather it's a matter of maybe the systems, the norms, the barriers, the social cultural norms that are embedded in the system. So I would say from the perspective of women in digital health is that we need to stop working on our solutions in isolation. We need to reach out to fellow entrepreneurs because they're there. There's someone who has worked on something close to what you're working on, and you can reach out to them and they can be a really, really good sounding board because they've probably experienced what you have experienced. And if not, they will give you a perspective that you hadn't thought about. That is one. And I know, again, going back to social, cultural barriers and all the roles that women have to get into, just aside from working on your solution, you have to keep a family, you have to build up a business. It's a lot, but we really have to be very intentional about how do I reach out to Carol, who has built solutions in Uganda, and that has worked, right? What does she know that I need to know so that we are not working in silos and we are not working in isolation? That's one. And then two, I think that one other thing I've noticed is that when I get to assess an application from a female entrepreneur or a female founded organization, I always notice that they've put in a lot of thought, a lot of work, a lot of time as well, and that really just translates to them, taking so much time before seeking support to figure out and make sure that everything, is perfect. And you would find that someone really, they've come to you and they've almost figured out all the pieces and the bits and pieces of their business, which then which is good, because when you get down to supporting them, you find that they're moving to the next stages very quickly. But then the time it takes for them to figure out everything by themselves, it's years, and probably no one has seen that. So I usually try to tell women entrepreneurs in digital health and in the health innovation space generally, not to wait until something is really, really perfect. And I think that's always comes with being a woman. We are naturals. We try to make sure that every piece is, fitting into the puzzle before we go for that opportunity to be supported by an accelerator, to be supported by an incubator, to apply for that funding. So I think it's just a matter of saying, you know what, I'm enough, I have done enough, and I'm going to go for this opportunity. So I'll stop there when it comes to women, the entrepreneur side. And for policymakers and other stakeholders on this other side, like investors and incubators like us, I think it's time to really ask ourselves why the current system seems to not be working for women, right? We can't just keep saying, oh, these are the statistics. We and accelerator programs would say, okay, we are not seeing any applications for women. By why is that, right? And I'll just go back to the research and the conversations we had with the women before we actually put out our applications. We learned a lot from that we wouldn't have if we just sat down as an entrepreneur support organization and said, you know what, women are not confident, they're not bold enough, they don't want to apply for these opportunities. We really need to take a backseat and see what we are doing that essentially is not necessarily encouraging women in digital health to show up and apply for such opportunities. And I think, again, it also goes back to just noticing and recognizing that we have, inherent and conscious bias when it comes to assessing and supporting women-led ventures. And in line with that, put women in VC selection committees, champion for them in stages that matter, right? In stages where investors are there, funders are there, customers are there. So if we are deliberate about that as policymakers, I believe there's a lot of change that can come from that. But I'll stop speaking. I think I've spoken too much.
Oh no, Snyder, you have been extremely inspiring. You have raised PowerPoints that are really the kind of conversations that we want to have. Just as the takeaway, what women entrepreneurs, especially in digital health, should know at any point of your journey, Snyder says collaborate, 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 right? Speak with other people, speak with other women in particular. But also she raised a very pertinent point, which is get out there early, get out there at the beginning stages of your journey, of your idea, of your dream, and let's give ourselves the chance to learn as we grow instead of, seeking to be extremely perfect. Because like we have seen now, the ecosystem has a lot of women like Snyder and Carol and Stephanie and a lot more of them who are willing to hold your hand on that journey from whatever point you are. So this is a good time to get out there. But also from the industry point of it, one way that those stakeholders can manage some of these gender specific barriers are to be intentional and proactive in mitigating those barriers for women, which again is one of the things that Vigro is doing, like we heard from Snyder, and also to be very conscious of the biases that exist. And sometimes to mitigate these barriers would mean that including women in the decision-making process, on venture fund boards and things like that, just so that there's some kind of balance and that the effect of those biases are slowly driven out. So these are extremely PowerPoints, and I'm very grateful that Snyder has shared this with us today. So we would navigate a bit to the other side of things, because like we noticed, Snyder is speaking a lot from the private sector part of this, and we would go to Carol, who it's true, Carol is in the private sector as well, because she's in PATH, but you'll notice that she's doing a lot of interventions for the public sector. So Carol, would like to know, what are the challenges that are common in implementing digital health solutions within for the public sector, if you get what I mean. So for example, you may be in PATH, but you're implementing a government intervention, or you're supporting a government intervention. What are the main challenges that you've encountered in implementing these interventions? And have there been any women specific challenges that also have you overcome them? Let's just have a discussion around that.
Thank you. The biggest challenge, of course, for Africa is the infrastructure, right from power infrastructure up to the gadgets and hardware for use at the health facilities. And I mean, not forgetting the capacity of our health workers. We build solutions up this side, and the users of these solutions are midwives and nurses at, say, a village level health facility where there is no electricity, where the network is very limited, and these solutions work entirely, maybe not entirely, can work offline and need to synchronize the data, and they do not have readily available connectivity. But also, even those who have connectivity have their capacity not built. And when it comes to the capacity of the health workers, it's not just the health workers at the lowest level of the healthcare system. Even at national level, you have health workers who do not even know how to operate a computer, who have actually never seen a computer even working. They have seen them and have not even touched them at all. These are the biggest challenges, and the solutions that are built are actually sent to these same health workers who have never used a smartphone, who have never used a computer, who have never seen electricity. those are the biggest challenges I have encountered in implementing these solutions. And then it turns out that even at implementation, capacity building is something that has not been paid attention to. There hasn't been any specific like tailored training programs for health workers to equip them with the basic skills of ICT, the basic computer skills. And even though there's been efforts to train these health workers on how to use the digital tools that have been developed, it still goes back to it's still in vain, because you train them and then leave and expect them to use these tools, but they actually cannot even use the computers. The other biggest challenge I have encountered is that as much as there is a political will, there is government will to adopt technology, there is government will in digital transformation, the funding from the governments is really not coming through. It is not a lot. Most of these implementations are heavily funded by donors. They are heavily funded by by partners, and even their implementation, you find that partners will come in to support this implementation. They come in with their staff, they support this staff to implement these solutions. And when this funding or the projects close, they close out with the staff. So there's like no capacity built for governments to sustain these solutions, to sustain these gains that they get from the partners and the donors, which is also a big challenge. So they end up leaving these solutions with people who do not know how to use them, who do not know how to sustain them. That is a big challenge, that this implementation is heavily based on donors, and government is not putting a lot of funding into implementation and adoption of digital health solutions. Over.
Thank you very much, Carol. So Carol like we were listening, she raised infrastructural challenges, the human capacity challenge, and the fact that private sector investment is limited, which limits sustainability. But I would quote you again, Carol, because it is you who said when you came into the space and saw challenges, to you they were an opportunity to make a mark and make a difference, and create a solution or make your voice heard. So I think that even by highlighting these challenges, we are giving ourselves a chance to see where there is a gap, where we as women can come in and create a digital health solution that will make a difference. Because like we can see, there are real problems and there are practical problems. But I'll just follow up with you, Carol, just so that you can give us an idea of what direction to go. How have there been any kind of challenges to address this solution? Maybe have there been entrepreneurs working on some kind of solution to address these challenges? Have there been, just what kind of, or even what would you think out of your head, off of your head, sorry, that would be challenges to address, solutions to address these challenges you pointed out?
I lost you there. I didn't get the question.
Oh, sorry. So I was saying, you did point out challenges in infrastructure, human capacity, and sustainability. And I was just wondering, especially because we have people in the audience who want to use these challenges as opportunities to create, a solution or make a mark. What is your experience of solutions that are in the works for these challenges, or just maybe your advice or your thoughts on what possibly could be solutions to mitigate these challenges?
Thank you. I do know that homegrown solutions can be easily adopted, and not just homegrown, but also solutions that have been built with the users. And I'll take an example of the community health information system that has been built with the health workers themselves, because they know how they do their work at community level, at household level. So their input and their involvement, the involvement of health workers in the whole process of developing these solutions, is really a deal breaker. Because once you involve them, they feel like their input is really valued. They also feel like their contribution to this whole digital transformation is valued, is noticed, and they're really recognized when you go to them and seek their input into growing these solutions, whether they're homemade, whether you're building a solution on an open source platform. The input from these users, the actual users of these systems, right from inception of the idea, is very key. I also find that the other way to go about these challenges and improve adoption of these tools is encouraging the interaction between the technology developers and the public health experts. There's still that big gap between those two groups, where technology people sit and do what they know best. And then also you have the public health experts on the other side doing what they do best. And then bringing them together is really still a challenge. But these two experts, if they work together, if they collaborate, they can really build and sustain solutions that will work for both ends. Because I mean, it's difficult to study public health and then IT, and also you find that our public health experts are people who, like right now, I'll speak for Uganda, our doctors, we have doctors who went to school almost 30, 40 years ago. And then technology was really not so there. And right now, the technology we are talking about AI. And I mean, these developers, tech developers, if they sit to develop these solutions and sit with these doctors, and it also goes back to the user-centered designs of these solutions, I think it would be a deal breaker also in solving the challenges related to adoption. And then also government funding. Governments need to really, yes, I know they've built these policies. There are African countries that are actually doing well and have evolved in terms of technology. I know the Kenyan president has really adopted technology and is really supporting them. Maybe we can learn from each other, from these African countries, from the countries whose context is similar, to see what has worked, how have governments put these policies now into implementation, and not just developing them and shelving them, and how they are aligning the donors to ensure sustainability of these solutions. But also continuous programs need to be, capacity building programs need to be built for the already in service health workers, so that they do not feel like technology is replacing them. They do not feel like technology, they are being left behind when these other doctors who are coming out now have all this they are technology savvy. So they need to be also focused on build capacity building programs tailored specifically for them at their level of expertise. There's so many of these, and we could speak all day. But I'll stop there. Thank you.
Excellent. That's excellent input. Thank you so much, Carol. Especially because you're presenting, both phases of, the challenge and what could potentially be solutions, which you listed as homegrown solutions, which of course support adaptability, support sustainability, intersectoral collaboration, and as well as an investment in human capacity. So we have Stephanie who has joined us now. Stephanie, we missed you earlier, and we are so happy that you have been able to join us despite the constraints. So I'm just going to bombard you with maybe 2 or 3 questions in one, because we have been waiting to hear your input. Maybe in first place, of course, we want to hear you say hi, and then we want to hear you share your thoughts on the current status quo of digital health in Africa, particularly with regards to female participation and women-led initiatives. And then right after that, maybe just give us your own experience. In your own experience, what are the key barriers that women face in becoming leaders or entrepreneurs or innovators in the healthcare space. So your thoughts on the status quo and women-specific barriers from your experience in leading in healthcare in Africa.
Thank you. Thank you. Good afternoon. Good morning, everyone. It's good to join you today. You know, it's interesting when you ask about the status quo of digital health, because what I like most about digital health is the wide range of areas and expertise that are included in the field. So when you talk about the status quo of digital health, we have to talk about what digital health means. And if someone went through this before, apologies. But what I find interesting is that I'm working with IT people. I'm working with health informaticians. I'm working with people with experience in telemedicine, people who develop apps, people who develop devices, policymakers, digital health practitioners, investors, et cetera, even health diplomats. So when we talk about the status quo of digital health in Africa, it is in some stages very well developed, and in some stages, it's quite nascent. So I think when we think of digital health, it's not one thing. So my corner of digital health is information systems and digital data. So this includes the people making policies that govern the way systems are constructed and used. So if we think about the countries across Africa, most countries are using electronic information systems. We could get into a whole conversation about what the status of these systems are and how well they function, but that's besides the point. The point is that there is a large-scale adoption of digital health across the continent. So I think it's important to just think of these roles, because how people are functioning in digital health. So in terms of the barriers that I'm seeing with digital health, when I was posed with this question, I stopped for a moment and I wondered if I was best placed to answer this question. I am a Black woman, as you can see from my picture, but I am not an African woman. I did not have that privilege. My ancestors came from Africa, but I was born and spent much of my life in Jamaica. And so there's an ocean and some cultural differences that make me a little removed from the realities of African women. But what I admire the most, as I have grown very close to some friends and colleagues in different countries, is a strong sense of family and community. This is not it's not the same in every country. And this strong sense of family and community means that there are different roles for males and females. And unfortunately, a lot of the responsibilities around family and culture, they fall on women. So women are excluded from or not encouraged to enter some areas of professional life or some corridors of power because of these social roles that they have. And so maybe one of the strategies that we need to put in place to overcome this barrier is to encourage more girls to engage with STEM programs or science, technology, engineering, and mathematics. I saw this World Bank report that less than 30% of the people pursuing higher education in STEM in Africa are women. And then in places like Burkina Faso and Ghana, it's less than 20% of women in the field of engineering. So what are the messages that we're sending to our young girls and even our young boys about these opportunities in technology-related fields? I think the other thing as well is, how are we recruiting women into digital health roles? A few years ago, I was recruiting, I and my colleagues were recruiting for a technology focused position, and we noticed that only men were applying for the positions. I can't precisely remember how the conversation went, but we started having this conversation about how men apply for the job they want, whether they're qualified or not, and women apply for the job that they feel most qualified for. That's a generalization, but I think that you can see how that might hold. So we decided to tweak the language in the job description, and instead of saying that an item was required, we said that it was desirable and softened the requirements a little bit. So after we posted, we got more female applicants than we did for the previous posting. So, you know, a second way of looking at the barriers that we're putting up around the participation of women in digital health is to look at our hiring practices and see how we can make them a bit more approachable for women. So I'll stop there for now and hand back to you.
Thank you, Stephanie. And yes, you have mentioned points that are very much in line with the conversations that we've been having. So like we heard, so Stephanie's perspective on the ecosystem or the status quo is very interesting, because the one word that she had was diverse, which for me is a message to say that there are many things that women can be in the digital health space. And I'm hoping that each of us take this message back with us. So you're not afraid if you're just a doctor, if you're just a public health specialist, if you're just an informatician, her message is there's many things that we can be in the digital health space. So that's something that from members of the ecosystem, hirers, venture capitalists, private sector stakeholders, in order to mitigate some of those barriers. So I'll just ask you one more question, Stephanie, just because we didn't have you earlier, and then we would have questions from the audience. Please drop your questions in the chat, and then we will take audience questions just after Stephanie takes this question. So Stephanie, especially because you are in the informatician data space, how do you think that improved data collection and analytics can empower women entrepreneurs or even women in the private
I think we lost Glenys. So if I
your
could just take that question. All right.
yes, please.
Glenys,
Yes.
can you hear us?
Yes. Yes, please, Stephanie. You can go ahead, please.
Okay, thank you. Yes, we had some digital health difficulties there, but I think your question was how can improved data collection and analytics empower women entrepreneurs and demonstrate the impact of their digital health innovations.
Yes,
And
exactly.
right. So I think this is a really big question. And it made me think about a book I read a couple of years ago. It was entitled Invisible Women: Exposing Data Bias in a World Designed for Men. If you have not read this book, I strongly suggest and encourage you to read it. It's written by Caroline Criado Perez. And then throughout this book, Criado Perez makes the case for how the world is designed for men. From sidewalks to car safety, the perspective on the world is male. And she talks about tech developers and mentions how products are not gender neutral. And when map apps fail to account for women's need for safety rather than fastest routes, when device makers, such as people who create wireless mics, don't think about women who wear dresses, how fitness trackers underestimate steps taken during housework because they only think of, perhaps when males are most active. So the world that we live in and how it may or may not be geared to your success is a first step, just recognizing how the data are structured across the world. I think it goes without saying that many of the decisions that are being made about which data should be collected, how the data should be collected, etc., is being made by men. So I think it's recognizing that this is the state that we're in. The name of the book, I saw the question, is Invisible Women: Exposing Data Bias in a World Designed for Men. So even though we talk about the numbers and we talk about how we collect data and the impact, I think it's important that we, even though we give these numbers significance, I think it's important to think about things that probably don't rise to the level of, the significance with numbers. I think numbers are important, but stories are important. And I think I saw that Nura Israth. I met her last year. And if you've not met Nura, I think she's a very important, powerful lady, woman in digital health that you should get to know. So Nura is from Uganda, and I met her last year. And I remember her telling the story about how after she babysat her nephew, and she was walking back and forth between the kitchen and her nephew, checking on her nephew, she came up with this idea to assist those caring with babies to be alerted when their temperature changes, because this might signal something's happening with the baby. And the idea became Autothermal. Look it up. This is amazing. It's an app, it's a medical device that helps clinicians to remotely monitor newborn temperatures so they can identify those that have thermal care needs. This is impact. This is one device, perhaps starting with one baby, but even one baby saved with this device is a huge impact. So I'm sure Nura is looking at the data that's coming out of Uganda, and she's looking at number of newborns, and she's looking at different regions of Uganda, and they're using this data to forecast device production based on regional proportions of women of reproductive age, regional fertility rates, etc. But I think it's important to recognize that even as we are looking to big data, and we're looking to big numbers to talk about impact, the work that we're doing with apps and devices are making impact because they're touching even one life. Thank you.
Thank you so much, Stephanie. And you did speak like you were here from the start. You mentioned something that both Carol and Snyder had mentioned in the light of we can use the opportunity as women to create solutions that only women can create in the most relatable and usable way. And that's a message that has resonated. But we also want to highlight the fact that in demonstrating the impact of digital health interventions, even though we were more focused on data, you did bring out the fact that women can use their stories and also can use whatever impact has been made, even if it's to one life, to demonstrate that our solutions are making a difference. So we do take that home with us. Thank you very much. So we would have a Q&A session now. Now, if any member of the audience wants to ask a question, you could direct it to a particular member of the panel, or you could just ask an open question and anybody would answer. You could leave your question in the chat, or you could raise your hand and we will give you the opportunity to speak. We hope that you have learned as much as we have. I personally have learned a lot. And Stephanie, I will definitely be looking at that book, Invisible Women, Data Bias in a World Designed for Men by Caroline Credo Perez. I will be looking at that. Thank you very much for the book recommendation. Please leave your questions in the chat. So we do have a question from Antoinette. Does not. So I'll just read it out and maybe we have a member of the panel answer. So Antoinette would like to know, how can international collaborations and knowledge sharing networks be harnessed to promote gender equity and inclusion in digital health innovations, specifically tailored to address women's healthcare needs in Africa? So maybe Carol or Snyder can take this since it's really Africa specific. Antoinette wants to know how international collaborations can be harnessed to promote gender equity and inclusion in digital health innovations.
I can take that. Antoinette, I think one way to go about it is to involve the parties and especially the funders who are participating in supporting women-led initiatives. And by involving, I mean we can, and just wearing part of an entrepreneur support organization, we can, in as much as tap into getting that funding from them, we can also involve them in the supporting of startups, and in this case, digital health solutions. So what we've done at Vilbro, and just borrowing from that, is when our funders approach us and they're interested in supporting, say, women in digital health, what we do is we also propose that in some instances they can be part of the support program, either by just doing master classes, and those master classes are geared towards a specific topic, and then most of the time we find that post the master class there's usually connections, there's networks to expertise, connections to expertise and introductions to other international networks that were initially not there. So just, like I said, wearing the hat of entrepreneur support organizations, we could involve the willing funders and the donors and other stakeholders interested in that, in the supporting of digital health solutions that are women-led. Yeah, that's, I think, one.
Thank you. Thank you for that, Snyder. So capacity building, sometimes via things like master classes, and use it as an opportunity to network and to build on these relationships. So our next question is from Mercy. Maybe Stephanie, you can take this. So Mercy wants to know, what are you doing as leaders to empower and mentor young women in the health space? And how would you advise young ladies who are from a STEM background, who have finished their studies but are not really sure where or how to start? I'm sure in terms of entering the digital health space. So what are you doing as a leader to empower young ones, and how would you advise a STEM graduate on how to get into this space?
Yeah, thanks, Mercy. That's a really important question. So when I entered into the digital health space, I realized that I had many opportunities or many circumstances where I was the only woman in the room. And I was surrounded by all of my really wonderful male colleagues, but still, I was I tended to be the only female in the room. And I think we need to talk about this. We need to say it more. We need to talk about how not normal this is. And in the opportunities that we have, is to mention, raise the fact, show that we need, we need more women participation. We need to be very deliberate about including women. So when we have panels talking about digital health, we shouldn't have a panel or a panel of only men talking. There are women. We just need to make sure that we're being deliberate in in including them. And when we are, as leaders, and I'm putting myself in this space as well, we need to be cognizant of it and always looking for spaces where we have women leaders in digital health speaking, because it's not the norm everywhere. And we need to lead by example and demonstrate to others that this is happening. So I think it's looking for those opportunities. It is being very, very deliberate and ensuring that you're recognizing the space you're in, the space that that you're operating in, and being sure to include other women in that space. Then the second part of your question, how would you advise young ladies who are from a STEM background? I think the beauty of where we are in, the history of technology is that there is such open space. This is not like when I had finished university, and there are basically only two things you could do. You could be a doctor or a lawyer. That's not the time we live in now. So I think there's so much talent and so much creativity out there, and it's fora like this where we are coming together and we are recognizing how many women are in this space. I mean, there were 90-something people signed into this webinar. We should connect with each other. We should be talking to each other. And we should be finding spaces for each other to talk about the work that we're doing. So I'm inviting everyone to, if we're not already connected, please connect and try and find a way to connect with each other, because I think that's how we will create opportunities in the digital space for women. Thank you. We can connect on LinkedIn. That's a very easy way to connect. Connect on LinkedIn, send a message, and further the conversation.
Yeah, so following up on Stephanie's recommendation, please do drop your LinkedIn, the link to your LinkedIn on the chat, and let's follow one another and connect with one another via LinkedIn. Thank you very much, Stephanie, for that. And also to vouch for Stephanie, for Carol, and for Snyder, and for Adrienne, who is on our advisory board. These are women who have shown that they are clearly empowering and inspiring younger women just by being part of conversations like that. As we know, they are obviously very busy. So for a woman with that kind of portfolio and rank and, just all of that to come and be part of conversations like that, we want to acknowledge that as a way that you are clearly leading and mentoring other young women. So we do have a number of questions in the chat. Anima is asking, how can we improve capacity building, especially for women? And it's very much in line with what Mercy says, because Mercy says, according to her, what is lacking is mentorship and training. And she's asking, and Anima is asking in the same light, how can we improve capacity building, especially for women? So maybe Snyder would take that very quickly.
All right. Thank you for that question. I think the one way we can improve it is by first doing a very thorough needs assessment. And I know if most of you have had this statement where they say that women are over-mentored and underfunded. And instead of, just having this cohort-based support situations and trainings, we really need to do a needs assessment so that we are meeting women in entrepreneurship at a point where they actually need the help, right? For example, you would assume that most of the time, of course, it's funding that is needed, but then at the same time, there's someone who, even that basic business skill of like running the business, registration, and all that is lacking. So when you take a step back and you do a needs assessment for the particular digital health innovation, then you get insights to what areas that are very, very specific to the need of that entrepreneur in this case. And in as far as access to these opportunities is concerned, I know most of them are usually very publicized on LinkedIn, especially, and there's a lot of programs that are intended towards supporting women. It's just a matter of actually being very intentional and looking up for them. Some of them are actually spanning across entrepreneurs that are at idea stage to way to production stage where they're already in the market. So looking at and being very intentional about looking for this opportunity is something that might be really, really useful. Sorry, I took too long, but yeah.
Okay, yeah, thank you, Snyder. I will just follow that up with our final question, which have been asked by both Ola and Marilyn in a way. So they're asking what networking platforms are available for entrepreneurs who want to start up in digital health, and how can women approach accelerators and incubators? I mean, which Snyder just began by telling us about LinkedIn, but maybe Snyder, you can tell us about other networking platforms, and also Ola's question about how to secure funding and grants to launch digital health products, and what's your view regarding angel investors or venture capital?
Wow, that's a lot. I would say again, there are a couple of groups that I'm aware of, and some I'm not. There is Women in Afrilabs. It's basically entrepreneur support organizations. Then the women in it have come together to essentially share opportunities and talk with each other. There's more other platforms that I can't even begin to share with all of you right now, but I would say do your research, go to LinkedIn, follow the right groups. There's Women in Tech Startup Forum group that I'm part of, and I think it might be a good place to start. But it's all about your research and where you are looking at for these opportunities and who you're following as well. When it comes to where to get grant funding, and I think those are the difference between angel investors and what again? I think sorry, let me just look at
Capitalist.
Okay. So angel investors really usually individual people who want to come in and give you a small ticket size funding for your venture. And in as far as those are concerned, it's always good to look at one who will come in and also not only give you funding, but also help you with growing the size of the pie so that it's actually attractive to the VC, which normally would only come in when you have a bit of traction and you're already in the market and you have some revenues to speak of. So there's a whole spectrum of the different types of funding at the different stages of your business. And so it's it won't take us a whole session to go through that, but I hope that clarifies. Grant funding opportunities as well. It's just the platforms that you follow, your desktop research, and being up to date with who's funding at what time and tracking that on your own in some Excel sheet or something like that. Yeah.
Right. Thank you very much, Snyder. Please let us follow up on those practical recommendations and especially do your homework. This has been a very informative session. I have been inspired. I've been informed. I'm going back with a book recommendation. But just before we go to the second part of our event, which is going to be brief, we promise, and which is going to be just celebrating some women who are doing some really impactful work in digital health in Africa. Just before we go there, would like to hear for just a minute from Stephanie, what is your take-home message for us today as regards the importance of women representation and participation in digital health? What's one thing you want us to go home with besides the book?
So besides the book, I want us to leave here feeling energized because there's strength in numbers. But besides the strength in numbers, I mean, you're looking around. I hope you've been clicking on the LinkedIn messages that have been coming through. There are many of us out there. There are women who are interested and just absolutely talented and are looking for either are looking to expand their space in digital health, or are looking for ways to have an entree in digital health. So I'm hoping you leave this webinar and this event just energized, because I know I am. And I'm looking forward to when I might meet you or meet some of you in person, but know that we are all in this together, that we have a particular perspective that we are bringing to digital health, and that we are just a strength to be reckoned with. So I'm feeling very energized leaving this event. Thank you so much.
Thank you, Stephanie. Thank you. You said that in a way that only a woman can. Thank you so much. Snyder, any last words for us? You did tell us that there is space to be taken and there is an opportunity here for us, but what will be your take-home message for us?
I think I'm just going to echo what Stephanie has shared. We have each other, and we can always take every opportunity to lift each other up. So let's not forget that. We always have something to offer to the next woman beside you. And we also don't need to be like men. We don't need to be as aggressive. We do not need to change ourselves. We can show up as soft as we are, but stand our ground and be hard. So that's it for me.
Thank you. That is very inspiring, very heartwarming. We are here for each other. We are here to inspire one another, and we're taking that along with us. Thank you very much. Our panelists have definitely over-delivered, and again, we are so grateful. But we will rush on now to the next item, which is the presentation of women in digital health in Africa. I would call on Monoru. She would come and go through that presentation for us. Thank you. Over, Monoru.
Hello, everybody. Thank you so much, Glenys, for giving me this opportunity. Ladies and gentlemen, esteemed guests, our panelists, and most importantly, the incredible women who have gathered here today. My name is Dorcas from Digital Health Africa. So it is with great honor and immense pride that I speak before you to celebrate the remarkable achievements of African women in the field of digital health. Today, we come together not only to recognize excellence, but to amplify the voices of those who dedicated and innovation have transformed healthcare landscapes across our continent. In every corner of Africa, there are women who have dared to dream, women who have dared to innovate and to defy the odds. They are unsung heroes, the trailblazers and the change makers who have embraced the digital revolution to reshape the future of healthcare delivery. Today, we honor leaders who have shattered glass ceilings, innovators who have sparked revelations, and advocates who have championed for change. We celebrate their courage, their vision, and their unwavering dedication to improve the health and well-being of our fellow Africans. So it is with great pleasure and excitement that we unveil the African Women in Digital Health Awardees class of 2024. Yes, we're gonna take a look at So those are the awardees for today. So our awardees will be published in the coming weeks, so you all can get a chance to read about their incredible work. Also, I'm gonna say congratulations to all the awardees. Your accomplishments inspires us all, and they have reminded us of the timeless potential that lies within each and every one of us. Thank you so much for your dedication. Thank you for your passion. Thank you for your commitment to building a better world for generations to come. However, let us not forget that our work here is far from over. As we celebrate those achievements today, let us look at the future with hope and determination. Let us continue to break down barriers, to change stereotypes, and to create opportunities for the next generation of African women in digital health. So together, let us continue to soar to new heights. Let us make history, one innovation, one breakthrough, and one life saved at a time. And before I finish, I would like to invite two volunteers from the awardees to give us a few remarks. So volunteers kindly from. Any volunteer from our awardees to give us a few remarks?
Can I go? I have my name.
Okay. Aremu has raised her hand, so I think she can go first, and then we'll have Ezine.
Okay. Hi, everyone. Thank you so much. It's been a very, very enlightening evening. And I want to say a very big thank you to Digital Health Africa for this award. It was really unexpected. I'm not sure who nominated me, but I would say it actually came at a time where I needed so much encouragement and motivation. So this is really, really, needful at this time, and it's meeting the need. As we were actually doing this program, I was actually submitting an application. So thank you for this award. And I want to say special thank you as well to whoever or those who nominated me, and to also congratulate every woman out there, every African woman doing remarkably well. It doesn't matter what you're doing. It doesn't matter how slow it is. It doesn't matter if it doesn't make sense to a lot of people. Just keep at it and seek support. Thank you so much.
Thank you so much, Aremu, for your remarks. We appreciate you so much, and keep doing what you're doing. On next, I see there is Ezine.
Awesome. I just want to say thank you once again to everybody. And I'm just going to sort of echo what the previous speaker has said, that sometimes you don't appear seen, you're doing stuff and you feel, I don't know if this is making an impact. And this is sort of a validation that you're indeed making an impact and people are seeing what you're doing. And that's an encouragement to yourself and to all the other women out there who are impacting one way or the other in the digital health space. So this is me telling other women out there, you can start small, do something, whatever space you have, occupy it, take over that table. Don't just get a seat at the table, take over that table, and you will definitely be seen, and you will not just be insane, you will make an impact. And say thank you, everybody. This has been very exciting. I mean, it's beyond my expectation, the session. And thank you to the speakers, and thank you to Digital Health Africa for this recognition of myself and other women amazing women, really. I was surprised who are also on this lineup. Thank you very much. Hi, Ivy.
Thank you so much, Ezine, for your remarks. I was supposed to take two, but I have seen Gaia has really raised the hand consistently, so I'd give her a minute to say something.
Hi, everyone. I just want to say thank you to Digital Health Africa and Speak Up Africa. I'm very proud to receive these awards, which confirms all these years spent promoting digital health in Africa. through the various positions I have held in several companies. This award is also a motivation, a great motivation to continue working for the advancement of digital health in Africa, particularly in Francophone Africa. So I want also to congratulate all these extraordinary women who are paving the way for digital health in Africa. Congratulations and thank you all. So may I also ask you please to maybe change the flag. I'm from Senegal. I think in the picture, the flag I have is from Kenya. So I love Kenya, but I'm from Senegal. Thank you.
Thank you so much, Kaya. It is well noted. We've all had the remarks of these very incredible women. They have all encouraged us to keep doing what you're doing, even if it doesn't look sane to other people. Keep the pressure, keep the fire burning, do what you have to do. As previously told, start from wherever place that you can start. We do not have to wait for it to be perfect, but we can start with whatever we have and then keep pushing and pushing, and eventually one day all our hard work is gonna pay. So congratulations to the awardees and good evening to you all.
Thank you, Monoru, and congratulations again, ladies. We are inspired by you. So for a closing remarks, we would invite Saitu Kama from Speak Up Africa, which is the organization partnering to present this webinar to you. She'll give us a closing remark.
Thank you so much, Digital Health Africa. This was such an insightful discussion, and I am so pleased to have the opportunity to take place or to attend such an insightful and rich conversation. I want to also congratulate all the award winners. I think it's very well deserved. And like Stephanie and the other panelists have said, I think now is just our time. It's really the best time to really come forth and show that we have several women that are working in digital health in Africa, and to really boost the capacity strengthening so we can get to leadership positions, because it's only through leadership positions that we will be able to make sure that our needs are taken into consideration in the policies and that we can really thrive and come forth. So on behalf of Speak Up Africa, I would like to thank all the panelists, thank the awardees, but also the participants and Digital Health Africa for this wonderful conversation. Thank you very much.
Thank you, Asaitu. Thank you. And a huge thank you to everyone joining. So, I mean, we are at the end of our webinar and we still have 44 participants. I'm telling you, I have been at countless webinars, and most times at this time you'd have had people drop off and just about 5 people are left. We are grateful, extremely grateful, heartfully. Oh no, that's not a word, sorry, but completely grateful that you have been with us throughout this webinar. We hope that you have been inspired. We hope that you are taking the message back with you, which is that a revolution is happening, and we as women, this time in history, we can be part of a revolution from the start. We can be the main players, we can be change makers from the start, so that there's no sidelining of women. This is our chance, and I hope that each and every one of us is going home with this message and ready to make a difference. Thank you so much to everyone for joining us. And here we say bye-bye, but we say connect with us via social media. Digital Health Africa and Speak Up Africa are on Twitter. Our websites are on the screen. Our emails, we're on LinkedIn, we're on Instagram. Please look us up, follow, connect. We are going to be continuing this conversation and this momentum after this webinar, and we hope to see you all in our inboxes somewhere along the way. Thank you very much, and bye-bye to everyone.
Thank you. Bye.